With me is one of the doctors who you may be familiar with, Dr Ghassan Abu-Sittah, who was a very pivotal surgeon in Gaza for a long time, also works at the University of Glasgow, and you've flown out here especially to help with the casualty rate, the big major health emergency that's going on here in Lebanon. What have you seen? What have you done? How are you coping? How is anyone coping here at the moment?
They're almost identical injuries affecting thousands of people. I mean, I think around 3,000 to 4,000 have been injured. And almost exclusively, the pager explodes in the hand while people are trying to read the message. And so we're getting mangled hands and penetrating injuries and blast injuries to the face and to the eyes.
And the people who are affected, your patients, who have you been dealing with, and how have they been? And paint us a picture of the type of injuries of the survivors are dealing with, and what you're doing in the theatre, because you've come out of theatre. I see you're ready to go back in again. Paint a picture of what's going on inside the hospital.
So these pagers went off randomly. Some people were in their car in confined spaces. Some people were sitting next to some of the wounded. Some of them were in the house when they exploded. And so what you have is a different kind of collection of people of all ages, men and women, who've come in with that blast injury. The catastrophic thing is that almost all of them will end up with some residual disability, some permanent disability. The hands, overwhelming majority, have been mangled with a lot of amputations, and a lot of the shrapnel has gone into the eyes with almost loss of eyesight, complete in one eye and some, unfortunately, in both eyes.
Among the casualties you mentioned, not just men. Have you seen many women and children? Because the assumption is that this was targeted at HEZBOLLAH fighters, HEZBOLLAH supporters and loyalists, and that was why the pages of many HEZBOLLAH supporters were affected. Is that right from where you're sitting?
So we've had women, we've had some children who were in the house when the pager exploded. Yesterday, when the talkie-walkies started to explode, there were some ambulance men who had these talkie-walkies, and they had to clear this area because the army had to come and detonate some of these talkie-walkies that were booby-trapped. And so it is a random act in which an explosive device, which is a day-to-day use electronic explosive device, is booby-trapped to explode at a given time amongst thousands of people who are about their day doing thousands of different things and injuring those around them.
Mm-hmm. You mentioned dealing with whole families who'd been affected. I mean, have whole families actually been casualties in this?
So we've had cases in which they were in the car and the pager was in between the seats when it exploded. We've had cases in which it was in the living room when it exploded. The two children who were killed, the children picked up the pager when it beeped. And that's how they were killed.
And this seems a bit sort of maybe callous to ask, but what is the mood inside the hospital? Because you've been working pretty much non-stop. I think you flew in the minute from Britain, you flew in the minute you heard about this spate of explosions a couple of days ago. How are people coping, first from the medical point of view, but also the large number of people, many of whom are still outside the hospital, looking after friends and relatives or who are affected themselves?
I think the fact that this is going to leave permanent disability has started to dawn on a lot of the families that we speak to. In terms of the medical staff, I mean, at this hospital, we're doing between 50 and 60 cases per day, and we're having to stop because we need to kind of just rest. So yesterday, we started at 8 in the morning and we finished around 9 or 10 at night. Today, we started at 8 in the morning and and we're probably going to go on till late hours of the night. And we still haven't operated on everybody inside this hospital. And on the day of the explosives going off, this is one of the biggest hospitals, and even they were struggling with beds. They had patients sleeping in the emergency department because this is one of the referral hospitals that a lot of the complex injuries come to.
I mean, an explosive device was found outside this very hospital and detonated by the Lebanese army. How do you feel about your own safety? And clearly you are seen in some parts of the world as a target, a compromised individual who the accusations are that you're siding with Hamas. Now there are going to be people, unfortunately, who feel that you're siding with a designated terror organisation under US and UK governments. How do you feel about that?
I mean, this logic goes against the Hippocratic Oath. Anyone who's wounded is deserving of my treatment and my care, and I would be remiss, even under General Medical Council rules, to deny people medical treatment based on their political beliefs or religious beliefs or anything. And so this idea of demonization of medical staff is part of what has happened in Gaza. You demonize the medical staff. It's one of the devastating things is on the day that I came, news about the deputy head of the internal medicine department at Shifa being tortured to death in Israeli prisons came out. And so this whole idea that the medical staff who treat people should also be considered a target is what has been happening not just in Gaza, where it's become systematic, but it's happened in the Ukraine, it's happened elsewhere. The use of health facilities as a legitimate target for military campaigns is going to have effects on wars across the globe for the next century.
Mm-hmm. Israel hasn't confirmed or denied their involvement in this spate of attacks, but I know the Lebanese government and obviously HEZBOLLAH are blaming them and vowing punishment. What's your take on it? You spent a lot of time in Gaza. Do you see any parallels? Have you thought about that?
So, I mean, certainly the idea of booby trapping a pager. I mean, and yesterday we were taking out pieces of screws and springs from people's eyes, from their hands, from their faces. Is a kind of diabolical idea of booby trapping thousands of pagers and then setting them off when people have them next to their faces. And so as a surgeon, my feeling or my thought process is the kind of level of disability, the number of surgeries these people are going to have. A hand injury of the sort that I've been seeing usually will take 5 to 12 surgeries in 5 years. The eyes, a blast like this, there's nothing that will bring them back. And the faces, reconstructing these faces, will take lots of surgeries. We have now thousands of people who will need major reconstructive surgical procedures and rehabilitation for years to come.
Dr Ghassan Abu-Sittah, thank you very much for joining us on Sky News. Good to talk to you.